Hello, it's Dr. Rhonda Johnson. Today is Wednesday, April 13th, 2022, and I'm talking about this second COVID booster shot because I keep getting a lot of questions on social media. But first, I want to share that I got my second COVID booster shot today. My first 3 shots were Moderna, and I decided to mix it up and get a Pfizer booster for my 4th shot and my second COVID booster because the CDC says we can mix it up. Now, a lot of people ask me when can they get the booster. So here's the basics that the CDC and the FDA advises that if you're 50 and up, you can get a Pfizer or Moderna booster 4 months after your last shot. But if you're 12 and up and you are severely immunocompromised, you can get a Pfizer booster 4 months after your last dose. Folks, you have to be 18 and up to get a Moderna booster. And for the second COVID booster, the CDC and FDA are not recommending a Johnson & Johnson booster. Now, the CDC director, Dr. Rochelle Walensky, in an NBC News interview on April 5th, said that people who had Omicron in December and February had a natural boost in their immunity to COVID, so they may want to wait 2 to 3 months before getting the COVID vaccine. She also said that if people are 50 to 64 and they're healthy, they may want to wait if hospitalizations and cases and deaths continue to fall across the United States. But she also said there's no downside into getting a booster dose now if you're healthy. So I know that's a little confusing for some people. So here's my little helpful tips. Number 1, talk to your doctor. Number 2, be honest with yourself about your medical risk factors. You may think of yourself as healthy. I mean, we all do, right? But the truth is, if you have high blood pressure, if you're overweight, if you have prediabetes or diabetes, if you have sleep apnea, if you have asthma, if you smoke any type of cigarette or cigar, if you have a mental health condition that is serious, you may not want to count yourself in that I'm healthy group. You may want to talk to your doctor and go on and get that second booster COVID vaccine. And also ask yourself about your lifestyle and your social habits. You know, a lot of people do not wear a mask in public, and they go unmasked, they eat out, they hang out in their favorite bar or hangout places. Again, you may be at higher risk of contracting BA2 or other variants. So be for real. And then think about the risk of long COVID. Long COVID is real. 1 in 3 adults report some type of lingering symptoms after COVID. And more clinicians are reporting patients showing up in their office with long COVID symptoms occurring 4 to 8 weeks after Omicron. That's my message today. My views are my own. I hope it's helpful.